Welcome to the final chapter of Psycho 105. So this is chapter 17. We're going to be talking about treatment of psychological disorders. So for part 1 of this chapter, we're going to talk about the helping relationship, which is what is the relationship between a client and their therapist, and how is that trying to help them? So the goal of treatment, the goal of therapy, or whatever kind of treatment you're seeking, is to try and help the client change their maladaptive thoughts, feelings, and behaviors. So this treatment is trying to allow people to live happier and more productive lives. So what kind of resources do we have available to us? You can talk to psychologists or psychiatrists, psychiatric social workers, marriage counselors, family counselors, pastoral counselors, abuse counselors. So there are people who are specialized in all different areas that might need help. So psychologists and psychiatrists are going to be people who are specially trained to handle things like treatments or therapies, things like that. Psychiatric social workers are specialized to work within communities to help different groups. Marriage and family counselors would focus on family dynamics or helping to fix marriages. Pastoral counselors are going to be your sort of spiritual leaders, members of the clergy, people who are trying to help you in questions of faith and spirituality. And then abuse counselors are people who help individuals through things like alcohol abuse or substance abuse of some kind, other kinds of unhealthy relationships with consumption. So the whole process of therapy is going to involve, like we said, a relationship between a client, the person seeking treatment, and a therapist, the person who is providing that treatment, who is doing the helping. And they're going to have this therapeutic relationship, so how they interact with one another. And also there's going to be some kind of applied therapy techniques. Now, a therapist can use a bunch of different treatment techniques to try and promote positive change in their client. And the techniques that they choose to use are going to depend on the therapist's own theories and ideas of what they think is going on and how they think they might fix it, which is all going to be sort of based on their training and experience. So each therapist is going to have a unique approach, and they're going to use what works for them. And our combination of that relationship between the client and their therapist, plus the techniques that they're using, should lead to some kind of therapeutic outcome, some kind of positive outcome where they're improving whatever it was that was causing issues in their lives to begin with. Now, this diagram here from the text actually shows us a pretty nice breakdown of all the different types of therapies for different psychological disorders that we're going to talk about in the rest of the chapter. And I will say right here that this chapter is not meant to be a comprehensive guide of all possible therapies. We're just giving you a brief overview so that you get an understanding of just how diverse and different all the different approaches can be. So we're going to look at things like psychodynamic approaches. So we'll talk about psychoanalysis and brief psychodynamic therapies. We'll go into humanistic approaches with client-centered therapies and Gestalt therapies, cognitive, behavioral, biological. And if you remember back to probably back in 104, when you first started taking introductory psychology, these different types of approaches are all kind of like the 6 perspectives that we started off back in 104 with. So we only have 5 here because those are the 5 categories that are most applicable to us treating different psychological disorders. So we're going to go through each of these. Each one will get their own section. So we'll go through that for the rest of the chapter.